We go back to this story from yesterday. The Rahima Moosa Mother and Child Hospital in Johannesburg lacks the most basic facilities to run a specialized facility, such as a blood bank, a 24-hour laboratory service, and even reports of expectant mothers sleeping on the floor, hotel personnel raped on the premises, staff property stolen. And these are only some of the revelations by Health Ombud Professor Malekgapuru Makgoba made yesterday after handing over to the Health Minister a report of his investigations into the hospital. The investigation was undertaken after a complaint was lodged by a member of Parliament's Health Portfolio Committee in April last year. But is this really the only healthcare facility in such dire straits? Let's get answers now, and for that we're joined by health sector analyst Professor Alex van den Heever via Zoom. Prof, a good morning to you. Thank you so much for giving us your time. Your initial reaction, seeing that report or hearing what the Health Ombud had to say, were you at all surprised by the shocking findings by the Health Ombud on Rahima Moosa Mother and Child Hospital?
I wasn't surprised. This is in fact very probably the case for many public hospitals at this point in time. What is very important about the report is that it actually documents it systematically, and the problems that it's revealing suggest that there's real issues with the overall kind of governance and accountability structures operating within the Gauteng province, but are probably not unique to the Gauteng province. This is the kind of finding you're tending to have in all the provinces at the moment, many of the provinces.
Are you saying that in many provinces you do have hospitals that simply don't have 24-hour labs? I mean, blood banks, that is incredibly concerning, that this is something that we're seeing across many other health facilities?
Yeah, so the report didn't only focus on that. It was the cleanliness, the infection control, the sort of the nursing problems, supply chain problems. All of those things are pretty common. The distribution of blood banks and 24-hour testing, but vary between facilities. Some public facilities will have that. The general problems are the ones that will be across the system, but an important issue here is that for a hospital like this, things like the blood bank and 24-hour lab access is crucial, and yet it's never prioritized, never properly funded, and never addressed. And it just shows that there's a lack of concern for this specialized hospital, where it's absolutely required. And it took a whistleblower to kind of raise the issue and make it public, Dr. Tindamaya, who was then attacked.
Yeah, the Health Ombud, when he started yesterday with that press briefing, emphasized 3 words to describe the state of the Rahima Moosa health facility. He said dirty, filthy, and unsafe. I mean, those are dirty and filthy are 2 very concerning words. I mean, unsafe, obviously, without doubt there. But are we seeing these hygiene issues then across many of our other public sector health facilities? And really what's going on there, where you do have staff, one would hope, that is there to clean the health facilities?
Well, what's very unclear is whether or not there is proper management in these facilities. In this case, the CEO was AWOL for large periods of time and clearly had no interest in running a hospital properly. If we look at a hospital like Tembisa, where what appears to be massive fraud and corruption was occurring, there's been no proper disciplinary action, no complete investigation that has resulted in anything since 2021. So this is very likely that this is a common theme, that many of the people that are appointed to run these hospitals aren't the right people. I think that is very much the position that the Ombud has, and that we have to look at the systems of appointment and their systems of accountability. It's not just a matter of who you appoint, it's how they're held to account. And what appears to be the case is that the province itself didn't care. And the CEO also didn't care because nobody else cared, and nobody was watching what they did with a massive budget and with a huge responsibility over a very, very complex organization.
Yeah, you talk about the CEO. Of course, the recommendation made by the Health Ombud is that the CEO of the Rahima Moosa Mother and Child Hospital be removed. But the Health Ombud also talking about, I suppose, a decline in the quality of CEOs across health facilities. I mean, let's talk a little bit about that. You talk about how perhaps the CEO didn't care because her principals didn't care. But who do we point the finger at when we do have obviously a leadership challenge within our critical health facilities.
So the process of appointment has been political up to this point. People who are appointed have been appointed by MECs, and in this particular case, there was an appointment process by the then Minister of Health at the national level, who appointed about 100 hospital CEOs almost directly. This is very problematic. You don't have politicians appointing people into hospitals. So the process of appointment, nomination, appointment, and removal needs to be separated from the executive of government. But that in itself is not, and that means that then the selection process gets the best person for the job, as opposed to be some political crony who doesn't have to worry about doing their job. The second issue is that you need proper structures of accountability. In other words, they must be reporting on what they're doing, have proper strategic plans, be properly implementing those strategic plans, being monitored on those, and forming part of a broader strategic set of interventions within the province as a whole. What we see here is that there appears to be this hospital is just running on its own. Nobody cares what it does and where its budget goes and how its resources are deployed. It's important to note that Gauteng's overall finances are in a shocking state in comparison to a broadly equivalent province like the Western Cape, which doesn't see many of the overall indicators that we see in Gauteng. So there's something very, very wrong happening here and in many of the other provinces.
I want to talk a little bit about the inequality story here, because essentially what you've got is I think it's about 84 or 86% of the population in South Africa that does not have medical aid, and so is most likely to need to use public health facilities. And really what those facilities how they compare to private health facilities, just how stark that difference is. And maybe you can even touch on what we've seen even come out of that Nehawu strike that saw healthcare facilities and services halted in so many areas, and what that does to a system that is already struggling.
Yeah, so on the comparison between public and private, if we had to do, because I've done quite a lot of this examination, a comparison between Western Cape performance and Gauteng, you see a huge differential despite receiving basically the same financial allocation and roughly facing the same socioeconomic pressures and changes in population. So there is a huge difference in performance within the same financial allocation, within the same resource constraints. So that indicates that there's something fundamentally wrong with the governance framework. The socioeconomics of Gauteng are very similar to the Western Cape. In comparison to the private sector, you're going to get quite a lot of that capability difference reflected. So it's not all about resources, it is about whether or not it's properly managed. So some of the difference between public and private is about that. And then the private might be overcharging in many respects in the private sector, but they will be running facilities at a reasonable level of management, pretty much in the way that, for instance, the Western Cape does, but is more resource constrained than the private sector. So the problem that we have is that public facilities are being mistreated, even with the resources that are being allocated. We're getting very, very low value for money out of our current accountability structure, which allows basically political patronage to dominate the decisions about appointments into leadership positions, procurement, and the deployment of resources. All of those are not based on what's best for patients, what's best for a region. We also have, which is a very important point in this report, what's often referred to as a spillover problem. That means people coming from other countries to South Africa. This is a problem that can't be solved by Gauteng on its own. It has to be solved by national government. And it's not necessarily by turning people away, but ensuring that within the region, those patients are funded for that cross-border movement by other countries. Now, that requires a multilateral negotiation at the national level of government. And to date, despite the fact many of us had raised this issue from 1994 till now, national government and the National Department of Health has done absolutely nothing. So we leave that problem unresolved, and we leave it up to individual hospitals to have to deal with demand that they effectively haven't been funded for, but can be.
Yeah. Alexa, let's leave it there, Prof. I really appreciate your time. I really wish that we had more time to talk, but a critical conversation. I imagine we'll be having more of it in the future as well. That's Professor Alex van den Heever speaking to us there.